Hello, my name is Brooklyn Stevenson, and I did my capstone project on the life prolongment of congenital heart defect patients. So to start off with, what are congenital heart defects or CHDs? So these are structural malformations of the heart that the individual is born with, and these have varying degrees of severity and effects depending on the type of CHD that is diagnosed. So in this review, I chose to focus on 4 common types of CHDs, including atrial and ventricular septal defects, detransposition of the great arteries, and tetralogy of Fallot. Tetralogy of Fallot and detransposition of the great arteries are considered critical CHDs, while the other 2 are not. And so all of these common types have varying degrees of effects on the blood flow and oxygen levels in the blood of the patient. For the methodology of this review, I used online resources like Google Scholar and the NCW library databases such as ProQuest and ScienceDirect to find statistics and mortality rates, as well as screening and treatment measures that are associated with CHDs. So screening and treatment measures were found to be some of the most important factors in prolonging the life of CHD patients overall. So screening methods can be prenatal or genetic screenings, and these are very important in the early diagnosis of CHDs. Critical CHDs especially need to be detected while the patient is still in the womb in pregnancy, during pregnancy period, or right after birth. And this is because many critical CHDs require immediate medical attention after birth. So a lot of times if a critical CHD is detected while the child hasn't been born yet, doctors will actually plan a delivery date so that there's no surprise delivery and they can receive medical attention immediately. So screening methods are super important. So the increased quality and provision of screening methods would be very helpful in prolonging the life of many CHD patients. Also, treatment measures are important because many CHDs, critical and non-critical, require treatment for the survival of the patient. And usually these are surgical repairments of the defect. However, there continues to be an issue of the need for further repairs after the initial surgical procedure. And this contributes to the high mortality rate associated with CHD patients in adulthood. So the recommendations that I concluded my review with are that increased access and provision of screening methods, as well as advancements in the treatment of CHDs, would prolong the life of congenital heart defect patients overall, as well as decrease the mortality rate associated with infants that are diagnosed with CHDs.